Hello friends, welcome back to my channel. Myself, Dr. MS HUSSAIN, consultant laparoscopic general surgeon with certification from Royal College of Surgeons, England. How are you doing today, my friends? I hope all of you are doing well and keeping up the good health even in this extreme hot and humid condition. I am here today to discuss a very small but a very important topic which is affecting whole of the world right now. The topic of today's discussion will be heat stroke. Though this is not related to my subject of specialization, but as I already said, the main motto for me opening this channel is to help my viewers lead a healthy life and a happier life. So I hope this video will be very helpful to you all and you will learn something very important and useful so that you can implement it in your day-to-day life and be a real world hero by saving someone's life. So without wasting much time, let's start it. So to start with, I am defining what is heat stroke. Heat stroke, it is the most serious form of heat injury and it is considered a medical emergency. If you suspect that someone has a heat stroke, which is also known as a sunstroke, then immediately call the hospital helpline number or the ambulance and give the first aid until the paramedics or the doctor arrives. Heat strokes can kill or cause damage to the brain and other internal organs. Although heat stroke mainly affect the people of age around above 50 years of age, but it also takes a toll on healthy young athletes and kids. So heat stroke often happens as a progression from milder heat related illness such as heat cramps, heat syncope and heat exhaustion. But it can strike even if you have no previous signs of heat injury. What are the causes of heat stroke? So let's understand it. Heat stroke results from prolonged exposure to high temperatures, usually in combination with dehydration. Mind you, dehydration, which leads to the failure of body's temperature control system. And as far as the medical definition of heat stroke is concerned, it is a core body temperature greater than 104 degree Fahrenheit with complications involving the central nervous system that may occur after exposure to high temperatures. Other common symptoms may include like nausea, seizures, confusion, disorientation and sometimes loss of consciousness or coma. So what are the symptoms of heat stroke? The hallmark symptom of heat stroke is a core body temperature. It will be above 104 degree Fahrenheit. But fainting may be the first sign. So you have to be very alert. Other symptoms which may include like there will be a throbbing headache. Patient will complain of severe headache and dizziness, lightheadedness. You got it. Lack of sweating despite the heat. The skin will be red, hot and dry. There will be muscle weakness or cramping pain. So you have to look for these signs and symptoms. Nausea, vomiting can also be there. There will be a rapid heartbeat which may be either strong or weak. Patient will complain of rapid breathing and shallow breathing. There will be behavioral changes as well, such as patient will complain of confusion. There will be disorientation or staggering, seizures, convulsions, unconsciousness. These are the things you have to look out for. Well, what are the first aid you can do in a patient with heat stroke? If you suspect that someone has a heat stroke, immediately call the helpline number or take the person immediately to the nearest hospital. Any delay in seeking the medical help can be very fatal. So while waiting for the paramedics to arrive or the doctors to arrive, initiate the first aid. Don't wait and watch. Move the person to an air conditioned environment or at least to a cool shady area and remove all the unnecessary clothing if any. If possible, take the person's core body temperature and initiate the first aid to cool it to 101 to 104 degrees Celsius. If you don't have the thermometers available, then just do the first aid. And now I'm going to tell you some cooling strategies. First of all, fan air over the patient. Fan air over the patient while wetting their skin with water from a sponge or a water source available nearby. Apply ice packs to the patient's armpits, groin, neck, or at the back, because these areas are rich with the blood vessels close to the skin. Cooling them may reduce body temperatures very quickly, right? Immerse the patient in a shower or a tub of cool water. But if the person is young and healthy and suffered heat stroke while exercising vigorously, which is also known as exertional heat stroke, you can use an ice bath to help cool the body. Do not use ice for older patients, young children, patients with chronic illness, or anyone who has heat stroke previously without any rigorous exercise. Doing so can be dangerous and it can lead to death. If emergency response is delayed, then call the hospital emergency room for additional instruction or the telemedicine department to get any help if possible. Workers at the hospital will rehydrate the person and replace the electrolytes lost through an IV fluid like normal saline or a ringer lactate depending on the situations. Now, what are the risk factors for the heat strokes? Let us understand it in detail. Heat stroke is most likely to affect older people who live in apartments or homes that don't have air conditioning or good airflow. Other high risk groups include people of any age who don't drink enough water. So drinking water is very important, or have chronic diseases, or who drink excessive amount of alcohol. So guys, quit alcohol if you do so. Heat stroke is strongly related to the heat index, which is a measurement of how hot you feel when the effects of relative humidity and air temperatures are combined. A relative humidity of say 60% or more hampers the sweat evaporation, which hinders your body ability to cool itself, as a result of which you feel very hot from inside. The risk of heat related illness dramatically increases when the heat index climbs to 90 degrees or more. So it's important, especially during the heat waves, to pay attention to the reported heat index, and also to remember that exposure to full sunshine can increase the reported heat index by 15 degrees. So if you live in an urban area, you may be especially prone to develop the heat stroke during a prolonged heat wave, particularly if there are stagnant atmospheric conditions and poor air quality. This is also known as the heat island effect, where the asphalt and the concrete stores heat during the day and only gradually releases it at night, resulting in higher nighttime temperatures. Well, other risk factors associated with heat related illnesses include some drugs. To start with, let's say age of the person. It can affect the infants and children up to the age of 4 and adults above age of 65 years. They are particularly vulnerable because they adjust to the heat more slowly than other people. Certain health conditions like those suffering from heart, lung or kidney diseases, obesity or underweight, having high blood pressure, diabetes, or patient with sickle cell trait, alcoholism, sunburn, mental conditions, and any conditions that causes fever. So medications, this includes antihistamine drugs, those on diet pills or diuretics, sedatives, stimulants, seizure medications, those on medications for heart and blood pressure, beta blockers, vasoconstrictors, psychiatric illnesses, any antidepressants. So these are the drugs which may aggravate the condition and may lead to heat stroke. So you have to be very careful during this peak hours, when particularly when there is a heat wave running all around. For example, let us discuss people with diabetes. They are at increased risk of emergency room visits, right? Hospitalization and death from heat related illness. May be especially likely to underestimate their risk during heat waves. According to a recent study, It is seen that those who are immunocompromised, like diabetes or HIV or having any other diseases like that, they are more prone for getting the heat stroke during the summer seasons, especially, right? So do take care of your elderlies very well during this time. Check with the doctor to see if your health conditions and medications are likely to affect your ability to cope up with the extreme heat and humidity. So now let us understand how the heat stroke can be prevented. So when the heat index is high, it's best to stay in an air conditioned environment. If you must go to outdoors for any work, then you can prevent the heat stroke by taking these small steps which I'm telling you right now. 1. Wear lightweight, light colored, loose fitting clothing and a wide brimmed hat. So take a hat or a cap if possible. Use a sunscreen with a sun protection factor SPF of 30 or more. Drink extra fluids to prevent dehydration. It is generally recommended to drink at least 8 glasses of water, fruit juices or vegetable juices per day, because heat related illnesses can also result from salt depletion. So it is advisable to substitute an electrolyte rich sports drink for water during periods of extreme heat and humidity. You can take glucon D or electrolyte powder available, or ORS. Okay. Take additional precautions when exercising or working outdoors. The reschedule or cancel the outdoor activity. If possible, shift your time for outdoors to the coolest time of the day, either early morning or after the sunset. There are other strategies also for preventing the heat stroke, which includes like monitoring the color of your urine. It sounds weird, but it really works. Darker urine is a sign of dehydration, so be sure to drink enough fluids to maintain very light colored urine. Measuring your weight before and after the physical activity and monitoring the lost water weight can help you determine how much fluid you need to drink. So if you follow these things, you can really come across a long way in tackling the heat stroke. If you are taking any alcohol, stop it. Drink water, ORS, electrolyte, avoid extra salts. The easiest and the safest way to replace the salt and other electrolytes during the heat wave is to drink sports beverages, water, ORS, electrolyte powders or fruit juice. Check with your doctor before increasing liquid intake if you have epilepsy or heart or kidney liver disease, or if you are on fluid restriction diets. If you live in apartments or house without any fans or airs conditioning, proper ventilation is not there, then try to at least spend 2 hours each day, preferably during the hottest part of the day, in an air conditioned, properly ventilated environment. At home, draw your curtains, shades or blinds during the hottest part of the day, and open the windows at night on the two sides of your building to create a cross ventilation. Now, what effect the heat stroke has on your body even after recovery? Understand it. After you have recovered from the heat stroke, you will probably be more sensitive to high temperatures during the following week. So, it's best to avoid the hot weather and heavy exercise until and unless your doctors tell you that it's safe to resume your normal activities. So, I hope all my friends has I hope all my friends will be liking this video, and hope they will take the gist of this video, and it will help them come a long way across to save certain lives, to protect themselves from the heat stroke. And guys, you can implement it in your real life, and you can be a real world hero by saving someone's life. Be a savior. If you like my video, please share and like and subscribe this video to your near and dear ones, so that they all can be benefited from this useful informations which I am giving you, and protect themselves in these extreme weather conditions and save others as well. So guys, stay tuned for more updates from myself. So right now I'm signing out. Hope to see you again very soon. Till then, take care and stay healthy. Thank you.